Today we are doing a PRP facial, and that stands for platelet-rich plasma facial. So why would we do this? Well, we would do this for somebody that doesn't want a lot of downtime because it really just looks like your windburn for a couple days afterwards, and for somebody that wants to restructure their skin. So the process is this: we draw blood, we spit it in our handy dandy centrifuge right here, and you can see the red cells have sunk to the bottom, and this is the platelet-rich plasma right here. And what we're going to do is we're going to drip that on our patient's face. She is numbing currently. We're going to drip it on her face, and then we're going to microneedle it in. So the microneedling itself will make thousands of little channels that will be forced to close, because you need to close up the channels when you make those on your face as a healing process. And as those close, you get tightening. But now we've also infused some platelets, and what those do is they recruit your stem cells over to the skin, and the stem cells go, oh, where am I? Oh, I'm in the skin. I'm going to make brand new skin cells and collagen and elastin and fibrin. It's just restructuring your skin. So it's very natural, obviously, because we're using your own blood. It's a pretty simple procedure, and so we're just this is our step one, which is drawing the blood, and you'll come back and meet with us in a few minutes after a patient is nice and numb, and I'll show you the process of the actual treatment. We are going to go ahead and start our vampire facial, our PRP facial. So I've put some of our PRP already on her skin, and I'm going to just start right up here. I'm just going to go in circles. And take a little moment, just get a little bit more on our cotton ball. And then we're going to. You good okay?
Yeah.
Okay. You're doing great from my standpoint too. This is the second layer of platelets that I'm putting on. I already have a layer of platelets on there. But, okay, good job. So we're going to go over her forehead a second time. So let's start over here. And I love this particular microneedling device because the needles come straight down. They're vertical. They don't roll, so you get the same depth everywhere you needle. If you had a roller one, as the needles roll, you have different depths everywhere, so that's not a very consistent treatment. So she's going to be, like I said, a little bit red after this treatment, and it's going to last for a couple days. But then gradually, I said her platelets, I'm going to go down your nose now, are going to recruit her stem cells over, and they are going to make brand new elastin and fibrin and collagen. And the microneedling device itself helps stimulate collagen because it's irritating those fibroblasts that make collagen. And it's great for pores too. Platelets are antibacterial, so there's not any risk of infection. It is good for acne treatments too because of the antibacterial effects of platelets. A little pinpoint bleeding is normal. That's not unexpected. We'll go one more time this way. And I'll stop abusing that upper lip. And you can really do PRP anywhere. So let me do your chin now. So the platelets, you can do this particular type of treatment anywhere there's skin, anywhere you want to tighten. So obviously the facial is a popular place, neck, chest, between the breasts. To lift the breasts, you can do all sorts of things with platelets. If our patient had wanted to, we could have saved some platelets and we could have injected the platelets like filler and that's called the PRP, or the vampire face lift. So you can do that. You can use them as filler. You can use it as filler. It reabsorbs in the next few days, so it looks like you didn't have anything done a few days later. But again, when you recruit the stem cells over, they're going to make collagen right in the area where we put those platelets. So if you want a little bit more in your lip, but you're afraid of filler, put some platelets in there. Awesome. So this is the facial. Injecting into the areas where you would want more volume would be the face lift. So cheeks, nasolabial folds, marionettes, under the eyes. That's the face lift. You can inject the breasts. That's a PRP breast lift. You can inject in the vaginal area, and that will help bring back sensation there if you've lost sensation. It helps with blood flow. It helps with stress incontinence, and that's called the O shot. So there's lots of things we can do with platelets. You can inject penises as well. That's called the P shot. And then you can inject the scalp, and that's for hair restoration. So lots of great things. We just did a butt lift the other day too. That was really fun with platelets. So we are anxiously awaiting our results here. No downtime really in the greater scheme of things. It does not help treat pigment. So if you had brown spots, those would not be better with this treatment, but we have other treatments for that. So I'm putting some hyaluronic acid serum on our patient's skin, and that just helps for slip. It helps the RejuvenationMD move around easier. And then we use the platelets and put those on top, so everything gets pushed in. So not only will she get the benefit of the platelets, but now I'm infusing hyaluronic acid serum directly into the layers of her skin too. So I know we always hear about hyaluronic acid serum on TV and how it's in every cream, but unless that serum, those particles are really, really small, it's hard for them to get through the layers of the skin. So for me to directly put them into the skin is fantastic. And we do that with our RejuvenationMD. A little spicy. No. Okay. See? The other thing you could do is you could put retinol and drive retinol into the skin, so that gets a really good peel. So, but if you're looking for no downtime, we don't want to do the retinol because that gives a really impressive peel. So I know her skin is really red and irritated right now, but it's going to be much better tomorrow. It's pretty remarkable as to how quickly things heal. And a lot of that has to do with the healing properties of platelets. You know, things I would tell her not to do tomorrow would be not to go swimming in a lake or a river or anywhere that might have dirty water. And I would not have her sleep with her pets where maybe they'd be licking her face or anything like that, because she has a whole bunch of open channels now. So we want those channels just to heal on their own without the potential for any kind of infection introduction. So we're going to give her an aftercare cream as a post-procedure cream. I would not want her using any Vaseline because that's very occlusive and it prohibits the moisture in the air from getting in and helping her skin heal. So we definitely want her to use our post-procedure cream that she'll receive. Avoid Vaseline, no retinol or retin-A for the next 3 or 4 days at least, because it'll just be a little bit irritating. And then after she's all healed up in a couple days, she can go back to her usual routine. I don't want you washing your face for the next 4 hours though, okay?
Okay.
Because all of these platelets
Are there.
are there, and we want them to soak in. So I'm gonna have her come back in about a month, and we'll repeat it. And so we usually recommend 3, and then typically 3 a year, just if she wanted to do maintenance. Or she could do other things. You know, we have other light laser procedures, but once you do one procedure, you're gonna wanna keep stimulating your collagen somehow, because we're still fighting all of the sun and gravity and things that got you here. So just to do 1 treatment or 2 treatments and then never do a treatment again, it's not going to be a great idea, because you want to keep it up. It's like going to the gym. I mean, you can't go to the gym for 3 months and then never go back again. You're not going to maintain. And your skin is the first thing that people see. So if you want to find out if the PRP facial, facelift, breast lift, O-shot, P-shot, hair restoration is right for you, come and see us at RejuvenationMD.